research because we know how to talk to the patient and we know how to help the patient understand what this means. So, just another shout out to nurse researchers that take things directly to the patient and understand what the patient will ask for and how they will interpret that information.
Great information, and very important for us as nurses in regard to clarification. So very, very nice. Thank you. Okay, so we're going to move along, and the next question that I have is a question. I'm going to start out with Ms. Brown, but I would like any of the panelists to chime in if they have anything that they are interested in contributing with this question. Ms. Brown, what can you tell us about barriers that you are aware of to vaccination in Kentucky, including barriers faced by minority populations? What challenges are we seeing that are being faced in Kentucky with the approximate 50% that are unvaccinated?
All right, thank you, Judy. So people of color or minorities face multiple barriers to vaccine access. And other than just access to vaccines, there's always the skepticism of a system that has treated them poorly in the past. And I think what we need to focus on is how do we then move forward and make sure that we, as people of color, do not miss out on an opportunity to get vaccinated, keep ourselves and our families safe, and as nurses, keep our patients safe, which is part of our responsibility. As far as access to vaccine goes, as being a barrier, the vaccine equity initiatives across the country is aimed at boosting vaccination levels amongst people of color. And so, because what we do know is that they were hit very hard by this virus, and they have lower rates of vaccination. So a lot of efforts have been part of it, going out into the community, doing vaccinations, mobile clinics, pop-up clinics, increasing the access for people of color to the vaccine. And now it's just for them to take a step and to actually get the vaccine.
Thank you.
Yeah.
Ms. Beach, this goes right along with the previous question that Ms. Brown just answered. Are there sectors or regions in Kentucky that you know from your position that are particularly falling behind in COVID-19 vaccination?
Yes, there are areas that definitely are falling behind. And in Kentucky, we know that the far west in Kentucky, those counties are behind. And then we also know that southeast Kentucky, which is often an area that has a lot of health concerns, which also make COVID more dangerous, they're also following behind. In Western Kentucky, we also have Christian County that is behind the others. And there are 5 counties that are listed as the lowest, and that's Ballard, Christian, Robertson, Hickman, and Spencer. But what I really recommend is that people in these areas, they get out, healthcare providers get out and talk to people in your community, talk at church, talk at work, talk to your family about getting vaccinated, because these areas are way behind. And then their disease level is showing that.
Reverend McCann, from the information that was provided on the minority groups and the regions that are falling behind, and then also as nurses, we as a group in the state, we are seeing the controversy in the area of being vaccinated versus unvaccinated, even amongst ourselves as nurses. So can you discuss some of the ethical issues that surround being vaccinated versus being unvaccinated? And what are you seeing among family members in the hospital of patients who are vaccinated or who have the disease? I'm sorry.
Okay. I think the first thing to say is that good decisions begin with good information. I think one of the things that we confront not only here in the state of Kentucky and in Hopkins County, but across the country to some extent, is that while there's a lot of good information available through reputable sources, people tend to pay attention more so to anecdotal evidence and to social media. And while social media has provided some helpful information at times, it's also an unscreened kind of information. So I think one of the things that creates an issue in terms of a barrier to vaccination is providing people with good information that enables them to then make good decisions. You wanted to know about people I'm seeing in the hospital.
Yes.
What they're saying. What I'm hearing most recently is from patients that we've admitted is, I wish I had taken the vaccine sooner, or I wish I had taken the vaccine. We're seeing primarily folks coming in who are unvaccinated. And as a result of that, their families are seeking out the vaccine. But it's just really unfortunate that they've waited and hesitated on that. I think one of the ethical issues that has come to the fore with this is the issue of personal liberty. People do not want to feel they're compelled to do something, even if it's in their best interest. But there's several ways that we can approach that. One of the ethical principles that governs that is respect for a person's autonomy. And certainly that's a premier principle in our society. I have the right to make healthcare decisions that I feel are right for me. But there's also a flip side to that. There's the responsibility that comes that my decisions don't just affect me. My decisions affect all of those around me. And so there's a degree of responsibility that comes when I exercise my autonomy to take into account not only how it affects me, but what about my family, my friends, my community, and to give serious thought to that balance.
Very thought-provoking, and I appreciate the candidness and the information that you just provided us, especially regarding families and how they feel, and what you are actually seeing on the front lines. Thank you. We have a question in the chat box from Christy Coe, and her question is, I have many patients that say they don't want to be vaccinated until it's approved by FDA. What do I tell them? So how about Dr. Carrico?
So I think that's a great question, and we hear that a lot. And I think part of it in our response, we need to understand what the process is for looking at a vaccine or any other drug when it goes through this type of stepwise evaluation. Now, the reason that we have it normally, we'll have all the phases of clinical trials, and we've all heard about phase 1, phase 2, phase 3, and then phase 4 that is the post-market and the kind of the ongoing surveillance. Well, when a drug is getting to market, and a vaccine or any other drug, it first goes through laboratory testing and animal models. So they have to make sure that the vaccine isn't going to cause harm. And then there is a very small, usually maybe 10 to 100 people that are involved in being evaluated to see what are going to be the effects of vaccine. Can we evaluate a serologic response, looking at blood work? Can we look at things in a laboratory? And these are all healthy people. Then we move on to phase 3 that involves larger numbers of people that can be evaluated. And this is still always starts off with healthy people. And then you begin to pull in people that are older. And I can say that because I'm officially old now. I hate to tell you, but once you reach 60, you're now old. And then we begin to look at people with comorbid conditions, diabetes, cardiac disease, cancer, immunocompromising conditions, and so forth. So we can look to see, does the vaccine work in normal healthy people, and does it work as people age and have health conditions? This is what we always do. And in these trials, there are endpoints that have to be met. So we have to look at safety. How often do people have serious effects? How often do people fail the vaccine trials? That is, it doesn't give a desired serologic effect. Those are regular clinical trials, and it takes about 60,000 people to be enrolled in a clinical trial to let you know that you're not going to experience, or you are not likely to experience, an adverse event greater than or less than 1 in a million times. So, and I know that sounds weird, but that's statistics and math, and we don't understand that, right? Anyway, it's magic. It's that magic that happens. And so this is what normally occurs. Well, in emergency use authorization, this means there is a public health emergency of some nature. And so the drug companies then are required to show safety information that the vaccine is not going to, we have no evidence that the vaccine causes harm, doesn't kill people. There's no toxicity identified, and that there is initial serologic evidence that the vaccine then can produce the desired effect to prevent disease. That was the emergency use authorization. That's what occurred and why we started enabling people to have the vaccine. Now, worldwide, we have had hundreds of millions of people that have been vaccinated. We have more than 6 months of data on hundreds of millions of people that have received it in the community, as well as the millions that have been involved in clinical trials. These are the data that go before the FDA and are reviewed by independent scientists. And they have, I think it's like 200,000 pages of documents to review, but it's all independent science review to move from the emergency use authorization to full approval. So I give you that background just so you kind of know the process. So when you talk to people, you can let them know that in order for a drug to even get out of the pharmaceutical company and into use, it has to have met these basic safety and efficacy endpoints that the FDA has said. They have to produce some benefit. It has to be better than no vaccine, and it can't kill your patient. Those are, and I think those are 2 important things, right? So we met that when the vaccine was first released, because we were confronted with a disease that clearly kills people, and having a vaccine where we don't have any evidence of it killing people, and it has some measure of efficacy. Now, over time, while the vaccines have been given to the general public, data have also been collected in clinical trials. There are people that are still involved in clinical trials. I know Delaware was involved in a clinical trial. I think Dr. Grant, you made that public about your involvement, and you're probably still filling out your e-diary, still going back in and having blood drawn and so forth to see, is there evidence of illness among the vaccinated group compared to the evidence of illness in the unvaccinated group. So you have these cohorts of people that are involved in these ongoing clinical trials that are providing data for full authorization. So I tell people that you're right, it is emergency use authorization, and this was because we had evidence that the vaccine is better than the disease. Now we have continued to have some vaccines move forward, and we've lost some vaccines, right? We had several hundred vaccine candidates that have come forward. Now we have 20 or so, and some of those outside the US have absolutely no data that have been reviewed by secondary independent panels. That's why it's not authorized for use in the US, That's why we still only have 3. We'll probably have Novavax coming forward that has provided these stellar data to look at. That will be another one that we'll be adding, I think, into the mix. But the FDA is our friend. Nobody ever, we always hear, I'm the government, I'm here to help you. None of us like to hear that, but the FDA is actually here to help us and is protecting us from medication, including vaccines that can cause harm. So they're doing their job. They are doing their job and they are being meticulous about it. And it's taking a little longer than anybody wants. But I think the whole notion of it's not safe until the FDA provides full authorization is inaccurate. That if the drug were not safe and it were not effective, it would be pulled from the market, just as we have seen other vaccines that have been pulled from the market and have not been allowed to move forward, even in the US.
Okay, thank you so much. All right, so we have discussed statistics, we have discussed ethical issues, we've discussed what is actually happening out there on the front lines. We still have hesitancy, despite all of the facts that have been presented and that we are aware of. So now is the time to talk about that very difficult topic. And specifically, we need to be talking as a state and as an organization about nurse hesitancy. So that's where we're going to focus our questions for the next few minutes. Ms. Beach, I'd like for you to start us out, and can you answer the question of how does nurse hesitancy impact public vaccination in Kentucky? And how does this relate to the nurse's role as educator and advocate?
I think it's very important because nurses are consistently listed as one of the most trusted professions on surveys. And so I think it's very important to get, as a group, for nurses to be together and be presenting the same message. I sent some surveys out to some hospital leaders and some public health leaders and asked that they get information for me from their non-vaccinated RNs that work on their staff, and that they could send it directly to me, and it would only be shared in the aggregate, and that there would be no judgment on that. And I did this because I felt like it was really important for me to hear from them and to see what they were saying. And the overriding theme, I think, is fear of the unknown. And so I feel like as a public health leader and a health manager or CEO of a healthcare facility, that I think we need to do better to get out there and educate our nurses. Maybe we've been doing more with the community and not working in our own backyard as much as we should. What I'm hearing is that they feel like natural immunity will take care of things eventually, but we've seen with other diseases that herd immunity often doesn't happen. It didn't happen with smallpox. It didn't happen with polio. I mean, it didn't happen with chickenpox. A lot of nurses now haven't seen that, but I have. And the patient's right to refuse. Well, really, when you're an RN or a healthcare provider, we're not talking about you only as a patient. We're talking about you as someone who could pass on a contagious illness to a very at-risk patient that had cancer or heart disease, or they're in ICU for something else. And so you're not just a patient. Health concerns for themselves. I have asthma, I have heart disease, and these types of things. Well, I can tell you from somebody who's worked over 5,000 cases with my COVID team that if you have healthcare concerns, you are the one who needs to be vaccinated, because these people with diabetes, heart disease, health concerns are the ones that are not having good outcomes from COVID. And we've seen that time and time again. If I get vaccinated, I can still spread COVID. That's something that's been coming out lately. And I heard that over and over in some of these emails. Well, but you're less likely to get COVID if you're vaccinated, way less likely. So that means you're way less likely to spread it. It's in a trial phase. It's not FDA approved. And I think Dr. Carrico just went over that very well. But that was listed on many, many concerns for RNs that sent information into me. Other vaccines had decades of time, so I take them like polio, MMR, but COVID vaccine is new. Well, I remember when hepatitis B first came out and it was new, but we all still took it because we didn't want to get hepatitis. And, you know, polio vaccine and smallpox vaccine were new vaccines at one point. So everything's been a new vaccine at some point. I had several that are pregnant and are very concerned about pregnancy, fertility, and breastfeeding. But the American College of Gynecology says that these are people who need to get vaccinated, that actually pregnant women are more likely to have serious outcomes from COVID, such as being hospitalized, being on ICU, ending up on a ventilator, and even death. So they recommend that their patients get vaccinated for COVID. There's been no research that has shown any fertility issues with women who have been vaccinated that want to become pregnant. And that's from the American College of Gynecology. I also spoke to a pediatrician that I work with that is also an epidemiologist. And he said there's no studies that are showing any risk for fertility for these women. But these were the main concerns. And I think we need to address them and help nurses to understand, because I don't think they're doing this trying to be disagreeable. I think there really is fear out there. And I think as leaders, we need to respond to these fears and know what they are and start working to overcome them. So I really enjoy being on this, and I hope that it will help.
Thank you, Ms. Beach. Reverend McCann, a hot topic that especially has come up in our area, our region, just within the past week, is the topic of employer mandate of COVID-19.
Mhm.
So can you discuss some ethical issues regarding employer mandate of COVID-19 vaccinations among healthcare workers?
Okay, well, I think we can start by looking again at that issue of liberty and autonomy. We tend to take that as a personal issue, that an individual has the right to make their own decisions. We can also look at that from a community point of view, that a community, a business, corporation has the right to a degree of autonomy in determining what's appropriate to the people that they serve, to the employees that they employ. And so mandated vaccinations are not something that's new. The EEOC says in their regulations that businesses, employers can set conditions of employment, conditions of returning to work. And so this would fall under that general rubric, that a hospital or a clinic, a doctor's office, another business would be on sound footing to say, in order to return to work or in order to provide a safe environment for our workers and for the people that use our services, a vaccine can be required. We do that in a lot of ways already. Schools do that. A number of universities have already stated that if you want to be on campus this fall, you'll have to be vaccinated. In Kentucky, just this past week, my own employer, Baptist Health of Kentucky, announced that vaccines would be mandatory. And October 31st is the deadline to complete that process. Across the river, Deaconess Hospital has also said that they're going to require vaccination. So it's not something that's new or that's unusual. but it does represent that sense that an employer has a right to protect its employees and to protect those that it serves. And people who are employed by those organizations do have the freedom to say, yes, I'll get vaccinated, even if it's reluctantly, or they have the freedom to say, I don't want to be vaccinated and I'll look for employment elsewhere. That seems rather harsh, but when you look at it in terms of trying to provide a safe environment for all people, and especially for those you serve, and particularly those who may be most vulnerable. And of course, healthcare institutions are serving those who are the most vulnerable, often with compromised immune systems or inability to be vaccinated. Those under 12 years of age don't have the opportunity to be vaccinated, and that places them at some significant risk. So in taking a communal point of view, I think we can say that there is justification for employer mandated vaccines. Now, along with that, we also have to say that there are some reasonable exceptions to that. And the EEOC says that when you require something like that, you also have to require a mechanism that allows people to opt out under certain conditions. And particularly, they say if there's a medical reason to opt out, you should be given that opportunity. The other opt out is if you have a sincerely held religious belief, then you should be able to respect that belief and to act on that belief to opt out. So in those two cases, we provide some wiggle room so that people can exercise their personal freedom when there's a justifiable reason not to participate. But we also have that opportunity to say there's community responsibility.
Thank you. All right, and this is a good point or a good section area to discuss some poll questions that Delano is interested in pursuing regarding nurses and nurse hesitancy. Delano, would you like to contribute at this point?
No, unfortunately, I've had some technical difficulties and my poll questions have disappeared.
Oh.
So, but at this time, there are a couple of questions in the chat box that are very interesting. And one is on the heels of Reverend McCann's comments. It's from Brooke, and she says mandatory vaccination announcements for healthcare workers went out in Northern Kentucky and Southeast Ohio today. Many nurses are expressing concern who are already burnt out from working understaffed. A recent poll was published prior to these announcements that 3 in 10 healthcare workers are looking at changing professions altogether. And since the beginning of the pandemic, do we think that this is a time of the profession to mandate vaccines that are causing more nurses to reconsider their loyalty to the profession? I believe the main concern is lack of data for long-term effects, thoughts on mandates and long-term effects. Maybe Reverend McCann and Ruth could address that.
Go ahead, Ruth.
I love this question because it asks a couple of things. Number one, certainly we know that healthcare workers are exhausted. We recognize that the stress, the overwhelming anxiety, the concerns about, am I going to be sick from work? How is this impacting my family? You know, that nurses have been incredible. And we have been right there beside our patients every step of the way. To me, this is even more important that we have this mandate, because we must, as nurses, the most trusted profession of all times, we must go to work every day with some measure of assurance that we will not cause harm to our patients. And just like, a nurse, we have to, somebody's got to work Christmas Day, somebody's got to work Ramadan, somebody's got to work Easter, somebody's got to work, all of these holidays, and we need to do so without artificial nails, and we need to wash our hands, and we need, there are so many things we do because we recognize the importance of that in caring for our patients. This is something else, that we must be vaccinated so we do not go to work and harm our patient. Will it create issues? I'm sure it will, that we will have some people that will leave the profession because of this. I don't think we'll have many. I think that we do have some that say, I will leave. And if that's your decision, I support your right as an American for choice. But you can't choose to harm your patient, and not in healthcare. We can't do that. So I think then if we have staff that will come to work unvaccinated, that will also hurt our numbers of healthy healthcare workers, because you will then potentially pass that on to your colleagues. So vaccinating does not hurt the numbers of people able to come to work. In fact, it probably helps keep us healthy and keep us on the job. Then that thereby then reduces the stress. With respect to long-term effects, I am completely unaware of any vaccine that we have discovered a long-term effect that was not recognized within the first 2 months of the introduction of that vaccine. The way that vaccines now are produced, in fact, these that are biologic and technologic developments for vaccines, the way that they are done, they can't produce some of these problems. Like we have a messenger RNA vaccine, it can't change your DNA. That's not how biology works with these vaccines. So we have people that have, I think, unfounded fears. And just like all of us have read the cartoon about somebody, a guy that says, hey, Marge, come here. I think I've discovered something of these vaccines that none of the other scientists and epidemiologists have discovered. How likely is that to happen? I mean, look at the number of people that are studying these vaccines every waking moment, looking for these problems, looking to identify, and we're not seeing it. The ones that we have reported, I think, are very open. In fact, we have erred on the side of many times over-reporting. If there is a potential risk, if it looks like a duck, then we're going to call it a duck, whether or not it is. So I think there is tremendous effort into ensuring safety. No other vaccine has endured this amount of public scrutiny and been able to withstand this amount of social media misinformation. So, I think we need to continue to push that forward. If we lose nurses because of vaccine mandates, to me, I think that is acceptable loss. That if we have a nurse that is willing to come to work knowing they may kill their patient, and this is the fact, I may bring the illness to work, I may transmit it to my patient, and they may not survive. If that is acceptable to a nurse, I would ask each of you, is this the nurse you want caring for yourself, your child, your older parent, your immunocompromised spouse? Is this who you think is acceptable? And I know that this is a value judgment, but I think it is a question of social justice. Is this acceptable for us? I would say that most of us will say no. I know I would say no.
I think along with that, Ruth, is that we need to be really careful to listen to nurses that have concerns and that are hesitant on this. They need to feel that, yes, they have been heard and that their concerns have been taken seriously. With that, I think then we need to provide that good information that responds to those questions to the extent that we can fully answer those. And then it's the appeal to what brought you into the profession to begin with as a person who wants to serve, and to support them in that service, doing the best that they can. So I think there's definitely that social justice side of it. There's also that personal side that people need to be heard, but they also need to have misconceptions corrected so that they can make well-informed, responsible decisions that meet not only their needs, but meet the needs of the people with whom they live and work.
Judy, we only have 7 minutes left, and there's one question that was in the chat box about the test. And I think if you will allow me, I'd like to read that. And I'm sure we can get an answer that would be pretty quick answer. And this is
Okay.
from a
And
nurse.
I would like to close with Ms. Brown, so that will be perfect if you'd like to do your question, and then I'll do mine.
Absolutely.
That's great.
Okay,
Thank
so
you.
this is a question that said that this person has heard that the PCR is the most accurate. Is that true? In addition, I've been told by a person resistant to vaccination that all of these positives reported in each state have many false positives and that the data is not accurate. I have trouble with this and would like some clarification about the test. And I know, Ruth, that you're quite an expert on PCR and the BinaX test. So could you respond to that?
I do that quickly, and then I think probably from a public health perspective, it would be good. So Denise may have then some insight into, you know, what is reported. But PCR is the most accurate. If you've got a positive PCR with the way that we have now to interpret those results, if it's positive, you're positive. There is evidence of that RNA. We don't do a live culture, but is there a recognizable piece of that virus present? And if so, we consider that test to be positive. Now, you can retain a positive test for a period of time after you are no longer infectious. So maybe that's what that person means. But if you're symptomatic, trust the test. If you're asymptomatic and you're getting tested, trust the test if it's PCR.
Denise?
Yes, PCR is the standard. It's very specific. If we have a test, which is an antigen test, and we're concerned about that, we do the test of the test with a PCR test. And the thing is, what we've seen is my staff and I have now done disease investigation and contact tracing. We've done over 5,000 cases, and the people with PCRs are generally sick. We talk to them. We know they're sick. The only time you're going to typically see a test be positive on somebody that may have some residual viral particles, and maybe they're going in for like a colonoscopy or something, and they're in that early stages post-COVID illness, and they still have some partial viral particles. But we know they're in that time period, that first 90 days after illness. We know that they haven't been exposed. We know that they don't have symptoms, and we do not count those if they do not meet case definition.
Thank you, Ms. Beach. All right, so we're going to conclude with one last question, and this is for Ms. Brown. Ms. Brown, regarding COVID-19 vaccinations, what is the nurse's role as educator and advocate? I believe you're muted, Ms. Brown.
Okay, so nurses, as it was mentioned earlier in the discussion, that we are trusted in the community. And so what we see is that if a nurse is vaccinated, they are more likely to recommend vaccination to others, including their patients. So nurses are at the forefront. They are continually being exposed to the virus at work, and they had increased risk of contracting and transmitting the disease. but they also have a powerful influence that can be used to help get more people vaccinated. They have to use, of course, factual information to educate their patients, and then have these heightened discussions, elicit patient concerns, and make sure that we are steering people in the right direction to get vaccinated. So it is important that the nurse herself or himself is vaccinated to then have the discussions with their patients.
Thank you so much. Excellent discussion tonight. Wonderful. It certainly has opened my eyes to some facts and dispelling some myths and some fears. So I appreciate so much, and thank you so much to the expert panelists for your guidance and your very valuable information tonight. Delanor has some announcements.
Thank you, Judy. First of all, I'd like to say there are lots of thank yous in the chat box for the panelists and also for you, Judy, for being an excellent moderator. So thank you all. We have our conference coming up in November the 4th and 5th. It's the summit. It's virtual. We invite all of you to attend. All of you that are KNA members, we are having our business meeting on October the 28th, and that'll be from 5 to 7:30. We also have our annual raffle that will support our Kentucky Nurses Foundation that provides scholarship and other philanthropy, and we invite you to participate with that as well. Again, I would like to say thank you all for attending, and you will be receiving an evaluation so that you may receive your CE for participation in tonight's excellent presentation. Thank you and good night.